Thank you for joining today's webinar, Best Practices in Denial, Prevention, and Management. If you have questions, please enter them in the Q&A panel located on your WebEx screen. A recording of today's presentation will be sent to you via email after the webinar. Today's speakers include Suzanne Crowder and Kelly Mekulenka, both Directors of Client Management with RCM here at NextGen Healthcare. Susan, I'll pass it over to you.
Thank you. Thanks for joining us, everybody. Today, we're going to discuss a wide range of information as it pertains to denials. We're going to start by providing you with a general overview of denials. We're going to talk about management and prevention strategies. We'll look at ways to calculate money being left on the table as a result of denials. And then we're going to look at some benchmarks that you can use to gauge your own practice performance. Today's session is meant to be interactive, and there will be a few polls throughout the presentation that we ask all of you to participate in. We also want to ask your questions, as Lori mentioned, and we'll hear your comments at the end of the presentation. So let's get started. I want to take a moment here before we go too far and look at exactly what is considered a denial. By definition, a denial is a refusal of an insurance company or carrier to honor a request by an individual to pay for health services obtained by a healthcare professional. These occur post-claims adjudication. These are not to be confused with rejections. A rejected claim occurs before the claim is processed, and those that are failed billing, or clearinghouse, or payer validation. As we go through today's material, all of the context and information we are sharing will be pertinent to a denial of payment, and we'll cover ways to manage those denials and optimal prevention from the beginning. Now, I want to illustrate why this topic is important to you and your practice. The impact of denials affects every single one of you. There's not a single practice that is immune. The denials are the cost of doing business is kind of a common thought. And the question is the squeeze of adequately, completely working your denials worth the juice that you get from doing that work? How many of you have assessed the financial impact of denied claims on your practice and know how much money is being left uncollected? This can be an overwhelming task to perform and alarming data when you discover it. What if I told you you could be leaving $1 million or more on the table each year from unworked denials or shortly worked denials? Let's take a moment to drill into the financial impact, seeing how much money that a practice can leave uncollected. This may give you the courage to dive into your denial analysis and start making some changes. In better performing medical practices, denial rates range from 5 to 10%. Other practices see denial rates on the first billing as high as 15 to 20%. That means that 1 out of every 4 or 5 claims that go out the door have to be reworked and appealed. For every claim that is not paid after the first submission, your practice will waste both time and money. When we talk about losing revenue, we're not just talking about the payment you are contractually expecting. There's also additional cash expenditures to rework and appeal the claim. The total cost to submit, correct, and resubmit of one claim is $25. And that is if, in fact, you rework the claim. Research shows that only 50 to 65% of denied claims are even reworked, and that the recovery rate is around 55%. This is just making a needed correction. If the claim is nothing to be corrected but needs an appeal for an incorrect denial, the stats are even more staggering. Appeals cost per claim up to $100, depending on the number of touches and time spent in the appeal process. The success rate for appeals is only 41 to 45% as a national average. To the right side here on this slide, we've pulled actual data from a client to help illustrate the financial impact of denials. It's a simple calculation that I will encourage each of you to take back with you and plug in your own numbers. The top table shows us a practice with 23 providers who created on average 210 encounters or claims per day. With approximately 260 working business days in a year, the practice generated just under 55,000 claims per calendar year. When they came to NextGen, their denial rate, listed here as current state, was 11%. With the average charges per claim being $437 and a recovery rate of 52%, this practice was letting go over $1.2 million per year. With denial rate reduction efforts, typically in the form of front-end automation such as RCX rules and established front-end claim edits, the practice was able to reduce their denial rates from 11 to 6%, cutting in half, leaving $687,000 on the table. If not looking at denial rate reduction, but increased recovery in the form of faster follow time, reviewing all denials and formalizing the appeals process, the client was able to increase her recovery rate from 52 to 75%. And again, cutting the revenue left on the table even further. The real power is when you combine both strategies listed in here and the combined effort column. With both reduced denial rates and enhanced recovery efforts, the client was able to reduce the cash left on the table by 71%, or in other words, collecting an additional $900,000. The table below this will also illustrate the additional expense per year using the average of $25 to rework a claim. Following the same logic, this client came in spending over $150,000 a year to rework claims. With improvements made, they were able to reduce this expense to under $50,000 per year for a 67% reduction in rework expense. To quickly recap impact to your revenue stream and the consequences of a denial, we know for a fact that denials erode the practice's bottom line. Each claim that needs to be corrected or appealed can cost the practice $25 to $100 in addition to the lost revenue from an unpaid claim. Your practices will feel the impact beyond the revenue loss and the expense of rework. A practice must also consider the impact in terms of days in AR and the lost opportunity. Resources that you have now who are spending time fighting denials could be deployed elsewhere to focus on other revenue generating activities or patient services. We're going to take a minute now to do a quick poll and get your response to a question. Let's take a pause and take a look at what your current average denial rate is. You'll see a poll come through on your WebEx. You would take a minute to respond, and we'll hold just a few seconds here and give everybody a chance to respond. We're looking at a rate, what you know is your current denial rate or what you think it might be. Less than 5%, between 5 and 10, between 10 and 20, or 20% or more. And there's an option if you're not sure. Were you able to share those polling results with us?
Yes, so I just applied the results. Are you able to see them?
I see. All right, looks like we're getting some responses here. I see about 33% have answered between 5 and 10% as a denial rate. And we have a handful with who are not sure. About a third, it looks like about a third of you are not sure what your denial rate is currently. We have a 2% that are less than 5%. Good for you. That's great. I always look at 5% and lower as a better performing practice. So those numbers seem to be holding pretty steady. We'll go ahead and move on to the next slide. So we might ask, why are we still talking about denials? It seems like if you've been in the business for a while, we talk about denials a lot and often, and it's not a new topic. We're aware that it's a problem and that processes need to be in place to address denials. But what I would argue is that it's an ongoing process. It needs continuous evaluation and assessment to determine if your process is still current and relevant. When's the last time you looked at your denial management process? Has your denial recovery rate improved, maintained, or declined? Are you agile in your response to payer, regulation, or service offering changes? Data shows that the denial rate is up 23% in the last 5 years, and that 35% of claims need to be corrected. Payers are constantly modifying their policies, and the environment around us is in a constant state of change. Just think of COVID and the impact it has had on our practices over a very short period of time. COVID testing, vaccine, and telehealth alone brought with them many revenue cycle challenges, denials among them. Your practice needs to have processes in place to stay on top of changes the day they are announced, and the denial management strategy immediately needs to be modified to accommodate changes. Your team needs to be aware and educated to those changes, and the need for continuous improvement impacts every practice and every individual within that practice. Denials are the number one metric that has the ability to diminish a practice's revenue stream. 90% of denials are preventable. 2 out of every 3 denials are recoverable. Allowing denials to be the normal course of business should not be the case. You should be reviewing your denial strategy, engaging your teams, and identifying the missed opportunities for denial prevention. So second poll, we want to talk about, ask you before we get into this, and for this section, what are the top drivers of denials within your practice? Your choices are going to be front desk, your registration, eligibility, and authorization, coding, documentation/medical necessity, general billing, for example, timely filing, or if you're unsure. Let's take a moment and get a response to this survey. Thank you. All right, I see some responses here. It looks probably not surprising to anybody that the front desk registration, eligibility, and authorization is coming in at a solid 55%. Next, popular is documentation and medical necessity with 24%, coding at 15%, and billing 9%. I think we're going to talk about this a little bit more, and I think we'll all see that that's a very common trend. So understanding denial types and categories is a great foundation so that as you identify and group your denials, you focus on the ones that are preventable and know which teams need to be engaged to resolve and prevent in the future. Denials can be considered fatal or non-fatal. Fatal denials are those that are not likely recoverable and almost always result in revenue loss, such as credentialing, timely filing, or non-covered services. Non-fatal denials are those that are likely to be paid after corrections are made or additional information is sent, such as medical records requests, missing or invalid information. You can also categorize denials as technical versus clinical. Technical denials are often referred to as administrative denials. Clinical categories based on medical necessity, level of care determinations, coding, and other clinically driven factors. These types of denials present unique challenges for organizations because they require additional medical or clinical clarification for payments and interdepartmental communication to resolve their denial. This makes clinical denials more complex than technical denials. And in addition to being more difficult to resolve than technical denials, clinical denials pose higher risk of affecting revenue. Now that we talked about the denial categories and types, where they fall in terms of fatal versus non-fatal and clinical versus technical, I'd like to talk about denial categories and types in terms of impact on the practice. This chart displayed shows each denial category and the volume as a percentage of total denials reported between 2019 and 2020. All denials on this display are avoidable denials. So when we're talking about low-hanging fruit, great places to start and revisit process and strategies to prevent denials, registration and eligibility related denials is a top priority. Second highest is claims data. Is your claims submission process set up correctly? Think TIN and NPI combinations group versus individual submission taxonomy codes. System file maintenance setup is very impactful. Authorization and pre-certification makes the top 3 list. Probably not a surprise based on our survey results as well. Bottom line, starting at your front desk is always a good place to start. I'm going to pause here and I'm going to switch to Kelly, who's going to talk to us about prevention and strategy.
Thank you. All right, make sure I can change this. All right, so I want to talk more deeply about prevention strategy and the benefits of revisiting internal processes in order to start reducing your denial rates and eliminating avoidable denials. Well, all right. So before we talk about essential components of an effective denials management strategy, I want to take a few moments and talk about the benefits your practice will realize when you have or implement a thorough and effective denials management plan, program, strategy, however you want to look at it, whatever you want to call it. In my opinion, the numbers that Suzanne shared with us earlier should be motivation enough, but just in case, let's take a quick walkthrough of some of these benefits that you will realize as a practice. So the first one that we have here is a healthier revenue cycle and maximized cash flow. This is really straightforward, right? The less denials you have, the more cash you're ultimately going to get in the door. It really is that simple. A good example of this would be the client use case that we talked about earlier in the table with the different statistics that we provided. The practice was able to increase their cash by over $500,000 just by reducing the volume of denials that were coming in, and then they brought in just under $1 million when they implemented other strategies and front-end processes. Another benefit is you will have a better and more robust denials management plan, which is going to facilitate better business decisions and process improvements. Your practice cannot make sound business decisions if they have the data or don't have the data or the insight into where and why the specific issues are, and the ability to highlight where the focus needs to be and where you need to implement improvements. Implementation of right solutions. So this is going to tie really directly into kind of the better business decisions that we just talked about and identifying where the process improvement needs to occur. If you have a denials task force that is able to review those denials and really drill into the root cause behind the why the denials are occurring, your team is then going to be able to identify, develop, and implement the correct solutions that are needed in order to begin the mitigation and elimination of the denials and keep them from occurring in the first place, which is the ultimate goal. Avoidance of future denials. So once you implement those right solutions, your team has created new or possibly made adjustments to processes and procedures that you already have in place, and you begin leveraging various technologies and automations, your team and practice is going to start seeing your denial rates go down. Once you begin avoiding those denials, your metrics are going to improve and the overall practice performance will go up. Increased recovery amounts. So there's really 2 ways that you can lessen your negative financial impacts caused by denials. One is going to be reducing your denial rate, and the other one is going to be enhancing your recovery efforts. As your team reviews the appeal wins and losses and focuses on enhancing the appeals process, such as developing processes for the first time, or maybe you're looking back and refining and fine-tuning, appeal templates or processes that you already have in place, the results will be seen in increased recovery amounts. You'll also have the ability to gauge your practice's effectiveness in denial resolution, or in other words, the ability to track and measure performance against set KPIs or key performance indicators. And this is going to be an essential component of an effective denials management strategy. Once you establish a baseline for where your practice is currently at in terms of KPIs related to denials, and then you can set your practice targets for where you want the practice to be. You'll be able to successfully measure their progress and then make adjustments if needed in order to reach those goals. You'll see improvements in other KPIs, not just your denial ones, days in AR, DSO, reduction in bad debt, and your write-offs. As a bonus here, you're also going to have your practice will typically have the ability for better resource allocation. I know Suzanne touched on that earlier. When before you had to have valuable resources, spending their time working denials and being reactive to them, you're now going to have more available time and be freer to work on other practice initiatives. All right, so let's take a look at the key components or ingredients, if you will, that are required to build an effective denials management strategy. The first thing you need to do is establish a denials prevention task force, or in other words, a denials management team. Great way to start in the assembly of that team is to consider every person who could or would touch a claim before the denial was received. As we saw before in the presentation earlier on, there's quite a wide range of denial categories earlier. Then we know that they're enterprise-wide, and the root cause of those denials can really originate from anywhere within the revenue cycle. It could be patient access, it could be registration, clinical documentation, coding, billing, utilization, even case management. So your task force should be formed by representatives from each respective area and can be used to analyze and prioritize denial trends, determine what resources are needed to implement those solutions, and assist in the identification and solution, and then track and report your progress. This team can be responsible for information sharing and also assist in ensuring accountability. Once you have created your task force, you're going to want to gain enterprise-wide support for both the team and your overall initiative. This part is going to be critical and is often overlooked. I really can't stress enough, in order to have a really effective denials management program, this has to be an all hands on deck approach. You're going to need buy-in from the top down and throughout the entire organization. Collaboration, communication, and commitment to both your process improvement and denial reduction is critical to the success of the team and to the initiative, and it's ultimately going to impact the results you get. The next step in the process is going to be the collection and review of data. Your denial management strategy has to be grounded in data. The team is going to need access to reports, analytic tools that house all of the data that will be used to ultimately drive your business decisions and help them establish the action plans that are needed to see improvement. While the data will point out where denials are and allow you to track and trend those denials, it's really important to mention and know that the data should be used as supporting information and evidence to help fuel the dialogue between other individuals, teams, and clinicians in order to raise awareness and measure the results. We see a lot, oftentimes data is used to kind of point blame, point the finger at other teams or even individuals, and this should never be the case. Data should always be used to support and aid in promoting positive changes throughout the organization. Moving on to the fourth step in the process, this is optimization and leveraging of technology. So along with analytics, technology can help prevent denials, and it is well worth time and investment. For example, here at NextGen, technology is used to automate eligibility, reduce manual review and intervention, autocorrect claims data. We implement standard and create custom edits in order to identify errors and to stop claims before they go out the door with the bad, missing, incorrect claims data that would ultimately result in a claims denial. Technology can also offer ability to create custom and auto workflows and ensure key processes and checkpoints along the way are not missed and can be used to connect with patients and assist in collecting updated patient information and demographics. Prevention. So this is going to be where the process improvement comes in. So you have your team established, you've got your stakeholder buy-in and support, you've run the data, and you've found where the areas need to be in terms of focus. So technology is in place. You need to look at where that process improvement needs to happen and where areas within the practice need the optimization in order to begin preventing of denials. It's going to be the action that you take here. They'll be incorporated in a variety of areas and teams throughout the practice, and it'll be a primary driver of the success that you see. When you implement process improvements, it is critical to make sure that the improvements you do deploy are sustainable by the team as well as the practice. So the final step that we have here is going to be, in effective denials management strategy, is going to be tracking and trending of your progress. So you want to use your baseline data and your improvements deployed. Your team should now be monitoring your denial rates and progress made on a regular cadence. Some of your metrics are going to turn around really quickly, but others will require further modification, review, and adjustment. And this is especially going to be true in examples where we consider payer regulations, payer policies, because those we know change, seems like daily sometimes. So those will definitely be slower to turn around, unfortunately. All right. So I want to drill in a little bit further, and I want to put what we know to kind of like a use case here and use one of the top driving categories in denials that we know of that we reported here, and put it into motion. The scenario that I'm going to provide you is an actual client outcome from what we saw when they revisited and started digging into their own denials, and relates to the story early on with the additional money that was found through making some changes. I was also happy to see the results come in with 55% being registration eligibility and authorization, because that is what we are going to focus and talk about. So again, registration eligibility, this is going to be a great place to start looking, even if you're one of the ones that didn't report this as your top driver, because it is really at the beginning of the revenue cycle. And as reflected in the data before, registration eligibility errors account for one of the largest percentages of avoidable denials. And with the benefit of being less complex to work in terms of resolution, they do represent a quick and easy win to improve overall revenue cycle performance. With registration, the most common denials that we see tend to relate to insurance verification, having an incorrect payer, possibly the patient not being covered under the policy, as well as max benefits reached. So for the following scenario that we're going to dive into, I do want to reference that the practice did start by establishing their task force. They did already have stakeholder buy-in and support enterprise-wide. And the denials task force team that they had in place pulled their denials data, and they performed an analysis. They looked at the data in many ways, by CPT, by count of denials, by denied dollars. They looked to see if the denials were limited to a particular payer, and even a particular employee within the practice that may be associated with a higher volume of denials. So it's important to note that when you're looking at data from a people perspective, the trend could simply be due to or point to one person in particular, because they are the primary person who performs or the related function within the practice. Or you could possibly find that one employee is not performing all of the steps in the process. For example, perhaps this individual is not asking for the insurance card when the patient presents, or not running an eligibility check upon check-in, and therefore these behaviors are leading to increased denials. So for this particular practice in question, when they did their analysis on the data, they noticed two particular payers. They made up the majority of their denials. They were patient not identified as insured, and the expenses were incurred after the coverage had turned. So as they continued to drill in, they did confirm that they had RTS, which is our automated eligibility tool, set up in the system, and their background business processor, or BBP as we call it, running eligibility automatically 3 days before the patient was seen. However, in a deeper dive, when they reviewed this, they did notice that the two particular payers did not appear to be providing eligibility responses back to the practice. They were able to identify that when these two payers were built and added into the system initially, the RTS, or eligibility, was not selected as part of the build and therefore missed. So to correct the issue, they ensured all payers were set up to run for eligibility, and they confirmed that they were then able to receive responses back for the particular payer in question. They also ensured that tasking was set up as part of the eligibility process for enhanced tracking and accountability. The team was assigned a list of patients who had these payers and were showing as inactive, and outreach began right away. For the individuals and the patients that were not able to be contacted or information updated, alerts were then set at the system level at the front desk. So when the patient came in to check in, the front desk team would be notified that the insurance information needed to be updated. This also led them to realize that asking for the insurance card was not occurring as part of the verification process at check-in. They decided to modify their internal processes so eligibility was being checked at the time of scheduling, and that any issues with benefit coverage would be resolved right there with the patient on the phone. And they also modified the process to ensure auto workflow was set up and that the employee asked for the card and verified benefits upon check-in. They implemented a policy that the patient was not able to be taken to the back and seen by the provider until coverage was validated. They also completed a check once more at claim submission. So it may seem redundant, but the practice did find that implementing a process to check eligibility at multiple points throughout the revenue cycle went a long way in preventing these common denials from occurring. In review of the eligibility responses, they also noticed a handful of payers that had messages being returned other than the expected active or inactive status and were being displayed with reasons such as the system's not able to process the transaction at this time. They received errors such as authorization access restrictions, and this was preventing the practice from gaining valuable eligibility information. So they questioned what had been done to address those reasons, and they realized that eligibility was not being worked fully or timely. And additionally, the employees was not able to understand what that response meant, and then only work the clear responses such as active or inactive. So in this case, the team submitted to have their RTS software optimized and the pair remapped to ensure that they would receive eligibility responses and confirm moving forward they would have those. So these are really quick fixes that needed to occur, but the team was not aware that they needed to raise awareness to the other members within their team to have this resolved. So a quick update to the SOP, education provided back to the team, and the issue was then resolved, and these pairs, they started receiving responses for these message types and getting these corrected at check-in and when they ran their eligibility. So furthermore, they also appointed a person who would be responsible for reviewing the health of the eligibility tool and the output that they were receiving to make sure regular maintenance and optimization was occurring as needed. As an additional finding, they noticed that on a few occasions, the BBP, the automation to run the eligibility, had failed. But the area within the system that would send that job fail notification contained an email address for employees that were no longer with the organization. So the email address had to be updated so that the job failure notifications in the future would be received by 2 newly appointed individuals. Process updates were also made to ensure regular maintenance, along with other various checks and balances were established to ensure regular maintenance and optimization of the BBP. So the team, after implementing the changes, they followed up on a regular cadence with the team to ensure adherence to the processes and to ensure accountability. They also put incentives in place to promote adherence. So from here, the team monitored the data each month at a minimum to ensure reduced denials for these were identified, if the area is seen, and the metrics have since greatly improved. So this is just one scenario of how denial review and resolution can play out for the practice. And as you work through the identification and analysis phase and areas of focus for other areas of opportunity, your denials task force will then be able to plan and make changes. And as you can see from the example above that we just went through, these changes could be people, processes, and technology related. So as you implement process improvements, I do encourage you to set goals of where you would like to see your metrics improve to. While 100% reduction of eligibility denials would be the ideal goal, you might find that starting with 90 or 95% is a great place to start, or possibly even 85%. It depends on where you're at today and where your practice needs to go. Once you start seeing results, it's going to be imperative for the rest of your practice to be informed and for you to share the progress and the improvements made with the rest of your team. Anytime a team is asked and tasked with a certain goal and processes are revised to improve those metrics, sharing these achievements and taking time to celebrate your wins is going to be essential in terms of continued progress, buy-in, and motivation, and really overall morale for the staff. So I know we have other things on the slide here. I'm not going to go in depth like I just did for the registration eligibility for these, but I do want to touch on the other 3 with some things that you can keep in mind, as they are all 4 of these are great places to start in terms of denial prevention and focus. So for missing and invalid claims data, we know by leaving just one item off of your claim, it can trigger a denial. This could be a missing modifier, a wrong plan code, missing accident dates. Possibly you don't have the referring provider on there or even in the right location. So I recommend that you review your denials that you have in this category, review the edits that you have in place, turn on edits, or possibly create custom edits where needed. You're going to want to review your claims production errors and automate where possible to eliminate the administrative burden and manual processes anytime possible. For authorization, so authorization denials, these are usually due to a failure to secure authorization in advance or because of a clinically driven change in the procedure. So authorization starts with procedure-specific policies that are crafted by managed by the payer, plan, employer, or even group levels. So to help bring awareness to the scope of the policy problem, consider the number of different plans and payers that your practice encounters on a daily basis. There was an organization that had completed a study on this. They looked at about 1,300 different policy documents across multiple payers. And what they were doing is looking for commonality across procedures, essentially what required authorization and what didn't. So when they shared the results, they revealed that only about 8% of the various payers shared authorization requirements or rules across all of those payers and plans. So while 8% can be really discouraging, there are 3 things that I encourage you to do with that. So the first thing is going to be define a role and ownership. You want to designate the team to govern your pre-authorization and authorization processes to ensure a reliable and stable approach. The second thing would be establish a screening and verification process to know what requires authorization and establish edits for CPT codes that you know require authorization. And ensure the team validates services rendered actually match the authorization on file. And if they don't, quickly get those updated, because typically a lot of payers will allow for up to a 72-hour, if not more, window to get those authorizations updated based on the procedure performed. The third one is going to be payer policy maintenance. So I ask you to review how you stay on top of your payer policy changes, because they change so often. Where is this information captured and stored and maintained today within your practice? And is everybody within your practice that needs to be aware of these payer update changes, are they notified? Staying on top of your payer authorization policies is a requirement in order to increase accuracy and reduce your authorization-related denials. The last one here is medical documentation. I know that was also something, I think we had 24% of individuals on this webinar say that was their #1 denial. That is a loaded question, and we don't have enough time for that. That would be a whole nother presentation in and of itself, because medical documentation can get so in-depth. But I do want to offer 2 recommendations to ensure that you have processes for that. So the first one is clinical documentation analysis. Go back, perform a thorough review to ensure that consistent and complete clinical documentation was present in the health record at the time of coding. And the second one is going to be conducting a coding analysis. Coding denials do offer a fantastic opportunity and a learning opportunity to identify any knowledge gaps in your coding staff. All right, so it looks like we are moving into one more poll that we have here. So the last one we want to cover is around benchmarks. So do you currently track, trend, or benchmark your denials? Possible answers here are going to be yes, no, maybe to some degree you measure them, or possibly you are unsure. So let's give it a few seconds, see what we have for a response there. All right, 41% said yes, 10% no, 14% to some degree, 12% unsure. All right, thank you. Okay, so let's talk about benchmarks and metrics. So it is important for every practice to measure and track your metrics. Our industry, I know, can be saturated with data, and it can be very inundating and overwhelming at times to know what you need to be looking at. So knowing which metrics are important to your practice is going to be imperative in terms of measuring your own success. I encourage you to know what the industry standards are for each of the KPIs that you have identified as important to your practice, as well as the specialty from an industry standard. What are your specialty metrics and how do you stack up against those? So I encourage you all to have set goals for what makes sense for your practice, and then track your progress toward achieving those goals. Offer incentives, celebrate your wins, and make sure that everybody knows that you're working toward, and be transparent in how you are tracking against those set metrics. You're going to want to seek input or otherwise improvement or opportunity ideas from anybody who could impact those metrics throughout your organization. Just looking at numbers without knowing where you stack up and where you need to be is truly meaningless. So to help guide you toward a few metrics that relate to denials, I do have here 4 common KPIs found to be useful when tracking your denials performance. The first one is going to be initial denials. So this would be your total denied amount and count in your first denied claim transaction. Obviously, lower percentages are better for your revenue process, and you're going to want to drill into this and identify the root cause to improve your performance. This is where you can identify your denial categories and types that need attention. If a high dollar claim is being denied, but your denial rate overall is adequate, so perhaps those who said that they were less than 5% or 5 to 10%, a further drill down may be necessary in this category. The issue could be a particular payer or a specific drug or modality of treatment that is holding up payment and lowering your cash flow. A formula to measure this KPI would be the count of claims denied over your count of claims submitted. Another formula that you could use is the same one, but with dollars. So your dollar amount denied over your total dollars billed for your first claim submission. In practices here, or medical practices, a 10 to 15% denial rate is industry average. However, keeping your practice and denial rate closer to the 5%, if not below, is really a more desirable metric and where you should aim to be. The second KPI here is write-offs. So write-offs is denied AR as a percentage of net patient revenue. This is going to indicate the provider's ability to comply with payer requirements and the payer's ability to accurately pay your claim. Write-offs are going to tie into the net adjusted collection rate. The adjusted collection rate should be 95% at a minimum. The average collection rate right now nationwide is 95 to 99%, with your higher performers achieving a minimum of 99%. You're going to want to use a 12-month time frame when calculating the adjusted collection rate. And one of the most common mistakes that we see is when payment posting is applying inappropriate adjustments to charges. So for example, failing to distinguish between a non-contractual adjustment and a contractual adjustment would result in misleading views of how well your practice collects the money it has earned. Write-offs can range anywhere from 1 to 5% of your net patient revenue. The third KPI here, resolution time. So resolution time, this is the time or day from the receipt of the denial to the time that the denial is resolved. The formula here could be the count of those days over the total count of zero balances that may or may not have a payment associated with it. This is going to help your practice understand internal process efficiencies and can be used for the trending and comparison of health plan compliance with any contracted appeal turnaround times. The fourth and final metric that we're offering here is recovery rate. This would be a percentage of your denials that are overturned. So a recovery rate is going to be an important metric, and it allows you to understand the rate of which denials are overturned, and it shows the practice's efficiency and effectiveness in recovering denied dollars. This could be recovery rate from either reconsideration or appeals process, and sometimes measuring it both ways can also shed some more light on your denials. Perhaps when you dig in, you might find out that your recovery rate is higher on reconsiderations than it is for appeals, and therefore it'll let you know that you need to take a deeper dive and review your current appeals process. A higher percentage represents successful outcome in overturning your denials for reimbursement. And the metrics is also going to help expose any issues with particular payers or types of denials where the appeals process may need to be enhanced. All right, so there are several reporting tools. I know there are many out there that can be leveraged that will assist your practice in gathering of data, performing the analysis, and measuring and tracking your denials performance. Both NextGen financial analytics and Power BI tools offer robust and drill down capabilities at the claim and encounter level denial level data, as well as your recovery level data. So please make sure that whatever technology you're using, you are leveraging that all of your reporting tools and technology to their fullest, and leveraging the data that makes the best sense for your practice and the KPIs that you track and measure. All right, so in summary, as we come to the end of the presentation, I do want to recap some of the key concepts that I hope that you do take away with you today from our presentation. The first thing is denials rapidly eat away at the practice's bottom line, but they don't have to. Denials should not and should never be accepted as a cost of doing business. While you may not be able to prevent 100% of your denials, you should be able to prevent and avoid most of them. Remember at the beginning of the presentation, we said that about 90% of all denials are preventable. So you should be working toward eliminating 100% of those denials. Avoidance begins with both development and adherence to your strategic denials management plan. And the more robust your management strategy is, the more money that you're going to bring back into the practice and that you'll be able to recover. Leaving money on the table that is earned and should be paid to your practice should not be an option. And most of all, remember that denial management is not a one and done. Practices who view denials as learning opportunities are going to be ahead of the game. So I hope that you take the key fundamentals of an effective denials management strategy that we've provided you with today and implement those elements into your own practice. We know healthcare is forever changing, so having a task force and plan to stay on top of those changes will keep you proactive instead of reactive. Letting denials bring down your performance and your practice metrics should not be an option, and you should never ever let your performance open the door to denials. I do hope that the information that we shared today was helpful and it provided you with some useful information. And if anything, perhaps it encouraged you enough to go back and look at your practice's denials and the current rates and your metrics that you do track and trend today, and look for areas of opportunity and improvement. I know that time is the most valuable resource, so I do want to thank you, Suzanne and I both do, for attending today's presentation on best practices for denials management and prevention. Thank you.
All right, so we'll open it up for questions. If you have any questions, you can enter those in the Q&A panel located on your WebEx screen. Let's see if we have any questions. All right. It says, could you provide some detail on how to report denials in NextGen?
Sure. Within the NextGen system itself, or within the reporting tools, so I'll kind of cover both of them. So denials can be tracked several ways within the NextGen platform itself. There is reporting tools, and Suzanne, definitely chime in, because I know there's so many ways we can do it. You can run reports directly out of the host system on, payers, CARGs, RARGs, all the way down to, the CPT HCPCS level, payer level. You can really slice and dice it any way you want. NextGen does offer several platforms for, reporting dashboards with a whole section just around. We've got over, I think it's over 110 already different metrics that you can perform, and many of those are around denials. And it's a true analytic engine where it just allows you to pick what filters. You can do it by practice, you can look at it by provider, you can look at it by HCPCS code. I mean, there's the options for how you want to view that data really is endless. So it allows you to manipulate the data to get down to the root cause of the why and to quickly see those trends. You can look at it from, the tools offer not just here's the data, but it can also put it in graph format with the ability to actually customize that data. So you can look at it from, a pie chart, a bar chart, a line chart. So you can really see those trends, whether it's 1 month, 3 months, 9 months, 12 months, whatever that rolling period is that you want to look at. So you can look at that long-term performance. But really, I mean, from a reporting perspective, both within the system itself, as well as within the external dashboards and reporting engines, the options are really endless for how you can look at this data. Suzanne, would you add anything to that?
Yeah, I would just add one comment. If you don't have access to the analytical tools within NextGen, you want to look for a report that's going to show transactions with reason codes. So it's going to show, the report's going to include reason codes, and then you can filter that, as Kelly mentioned, by physicians and payers and so forth. And I find it easiest to, because it's going to be a lot of data, because you're looking at, line item per transaction per encounter. And so the best thing would be to kind of leave the sorts off of the NextGen report and export it to Excel and sort within Excel, so you can sort by the reason codes or whichever way you want to slice and dice. And, just as a comment, I don't know if we were mentioned it in the presentation, but if you haven't begun the process of having a real solid denial program, it can be overwhelming and intimidating to kind of start and to look at that kind of data, because there's so much. So I would recommend just picking an item, pick a, let's say it's eligibility. Let's say it's, a particular reason code that you see a lot of because the patient is outside of eligibility. Pick that reason code or 2 or 3 reason codes and start with them. Pull that data out and focus on those, and so you can kind of get a feel for what you're looking at and how to interpret what you see. And so you start somewhere, and then once you get started and you do that for a couple different items, you'll feel more comfortable with it and be able to use that data to serve your needs.
Absolutely. And I would also add, it's not just the reporting of the denials, the analytic tools that I know that we have access to, and that, as a client, another important thing is we talked about the recovery. So yes, here's your denials. You had this number of denials for, this dollar amount for this provider. You're looking at your processes, but then to make sure that your tool also in ours offer is the recovery component. So, if you had 100 claims denied for, $50,000, what became once you made those changes and you got those claims back out or appealed or whatever it is you did to get those reconsidered, the reporting will also tell you your recovery. So of those ones that were initially denied, what ended up the final result? Were they paid? Did they end up in bad debt as a write-off? So it'll also give you that breakdown so you can kind of say, from a percentage perspective, what was the final outcome after the actions were taken. So you can track and trend your recovery perspective or percentage. Hope that.
Thank you. Any advice on credentialing denials? Are these typically fatal?
Yes. Yes. Credentialing is, unless it's, the payer's error in credentialing, making sure that you have a solid credentialing tool, monitoring that, having processes in place to ensure, as much as I know we want to get those physicians off the ground and running, make sure your credentialing is complete and intact before the provider starts seeing those patients. It really is essential because unfortunately that is going to be one of the denials that those are fatal denials.
Okay, great, thank you. It doesn't look like we have any other questions. The rest are just comments in there. So I appreciate both of you speaking today on the topic of denials. I think it was very beneficial. And thank you to everyone who attended the webinar. We appreciate your time. We know that's very valuable. If you have any questions, don't hesitate to reach out, and we hope you have a great rest of your day.